A crown rump length from the time we see a gestational sac up until 13 weeks, 6 days. Okay. While I'm talking to my patient, first off, I'm going to bring them into the room. I'm going to find out their information. I'm going to give them a gown and say, I need for you to take everything off from the waist down. Okay? And they'll say, even my panties? Yes, even your panties. Okay? Don't let them go to the bathroom. Okay? Because we need that urine in the bladder. Because they're going to ask you, oh, can I go to the bathroom first? No. I'll let you go to the bathroom in just a few minutes. Right now, let's go ahead and get what we can get done. I'm going to do everything that is on my pelvic ultrasound transabdominal. I'm going to send her to the bathroom, empty her bladder, and then I'm going to do the exact same exam again. The exact same exam again. The only difference is because the ovaries now, I'm going to do superior, mid, and inferior, lateral, mid, and medial. That's the only difference. Okay? Except crown rump length, yolk sac, heart rate, and gestational sac. Okay? They're exactly the same. Okay? Be sure you get all of the transabdominal images that are on the protocol. Because what if you send her to the bathroom and she said, no, I don't want a transvaginal. Okay? We can't say, well, you have to, you know, but I'm going to go and tell the radiologist. And if the radiologist thinks that she needs a transvag, the radiologist will come in and talk to them. Okay? I don't try to talk my patients into having an exam they don't want. You know, they might not want something up there if they're pregnant. Because they think that it's going to hurt the baby. You don't say, well, you have sex still, don't you? That's not your job. I have done that before, though, because I was in a pissy mood. Yes.
Although the LNP might, I guess it's subjective.
It's subjective.
You don't change that once the ultrasound.
You never change it.
Okay.
You never change it. So when they come in for sequential exams, you're going to use the exact same information because you're going to pull that information. Because we also have an OB computer that information goes in. Now that OB computer lets me know if the baby is growing at the rate that it should. It helps me know that. Okay? Because if you look on page 327, that is part of the OB package. That is part of the OB package. But look at on page 328, figure 14.2. That's how they track the growth of the baby. So this lady has had 3 ultrasounds. Okay, that lady has had 3 ultrasounds. And they're within the range.
29.
Okay, they're between the range. If one of them comes off and it's either higher or lower, that means I have a bigger baby or I have a smaller baby. So if those little asterisks were above the 2 lines, I have a bigger baby than normal. If those 3 asterisks are below that mid-range, I have a small baby. Okay? A big baby is just as dangerous as a small baby.
For delivery.
Huh?
During delivery?
No, they're both at risk. They can die in utero. They can have problems developing in utero. thank you. They can be stillborn, IUGR. I mean, they can fetal demise. DEMISE means the fetus has died.
And most pregnant diabetic woman, she has risk for the big baby.
Yeah, that's called a macrosomic baby. And you'll see those a lot with diabetes, gestational diabetes. Okay, now, when we're there and we're talking to the patient, let's just say the patient is scared. Okay, you've already started your exam and you notice the patient is weeping. Stop your exam. Show some compassion. You know, freeze the transducer. Don't leave it live. Because if you're just sitting there talking to the patient, you want to talk about it. Is everything okay? You know, don't draw any conclusions, because unbelievable, you will not believe the stories that these people tell you. Straight face. Sometimes I'll get on the edge of the bed and sit there and just hold them. You know, because that's what they need. Okay? Do not give them advice. Just listen to them. Okay? So, what am I going to do? I'm going to freeze the transducer. So that's going to lower my Alera. Okay? I'm not going to sit there and talk to the patient and my machine is just sending ultrasounds into the fetus. Because what happens is it heats up the tissue. It heats up the tissue. I'm never going to do an OB at 100% power. Okay? Our machines are preset. So you might do an abdomen at 80%, but when you hit that OB preset, it drops down to 50. Now, if you were to do someone like me, I would have to use a 3.5 megahertz because I'm fat. I have a lot of tissue to go through. Okay? But if I do someone like Ann, I'm going to use a 5 megahertz or sometimes even a 7 megahertz if I have that available. Because she doesn't have any fat. Okay? Now, I might have to change transducers during the exam. Because her baby might be laying on its back. So I've got to, like the baby's spine is against the mother's spine. I've got to go deeper. I won't use a 7, I'll use a 5. And then if I still can't get it, I'll use a 3. Okay? You're only as good as you can work your machine. And it's our job to get diagnostic images for the radiologist or the gynecologist. Okay? So, if you work in that setting, you're going to have all machines set up. I mean, all transducers set up. Why is that? Why is that? Say you had no idea about ultrasound, and I got out of my chair twice to change the transducers. What's my patient going to think? Oh my God, they found something. Why does she keep fooling with the machine? Is my baby dead? Is my baby deformed? But if you have your machine all set up, all you do is have to push a button. And while it's resetting, talk to your patient. How many other children do you have? Have you thought of a name yet? You know, Georgette's a good name. Of course, my daddy's name was George. Okay. Most of our machines that you're going to see in the clinical setting, you have to choose the correct patient. Okay? Be sure you choose the correct patient. You don't want to do one patient under another patient's name. Be sure you double and triple check the patient information. Isn't that right, Asil? Some people have to do manual entries. you know. And whenever I do that, look at page,
327.
okay, look at page, 327. Now, the top of that report is all patient number, who the sonographer was, what their birth date is, but it's also gonna have their LNP. And it doesn't have it on this one. It will tell you how many times they've been pregnant, how many times they've given birth, and how many abortions they've had. Okay.
I think in the other one, we have it in the other.
It's in the book.
Uh,
You're on the page right now.
in the abdomen book, we had this page you talking about.
No, we're talking about OB package.
The OB.
Yeah, we're talking about the OB package. Okay? Now, when you put that report in, it's gonna be on that front page that we take an image of. It's gonna be on that very front page. But after you finish the exam, you're gonna take pictures of your reports. It's gonna put in all of your measurements. Okay? And that's how you get the second image. Okay? So the first image, it tells you the first image, it says the BPD, the OFD, the head circumference, the abdominal circumference, and the femur length. Those are the measurements that we do on 14 weeks up to 40 weeks. And we're gonna talk about that this time too. Okay, so what am I looking at here? See how the bladder is on the left-hand side of the screen? The patient's left? That's because this is what we see first. Here is my vagina. Here's my cervix down here. Here's my fundus here. So this is an anteverted uterus with a gestational sac. Okay? With a gestational sac. So I do my length. Can you get those lights? I get my length. I get my height. I'm gonna turn transverse on it, and I'm gonna get my width. Then I'm gonna do the same thing for my gestational sac. Okay? Now, is this one sagittal or transverse?
Says though.
It's sagittal. See, here's my cervix here, my lower uterine segment, my fundus. What is this called right here? This echotexture.
Posterior.
Posterior enhancement, because it's just fluid. Okay? So we've already talked about this. We want to know their LNP. We want to know their pregnant history. How many pregnancies? How many did they how many did they give birth to? How many abortions or miscarriages they had? And it's going to give me their EDD, estimated date of delivery, or some machines will say EDC, estimated date of confinement. Because there are some cultures out there that once you have your baby, like for a month, you don't have any company, you can't take a bath, you can't you can't take a shower, you can't wash your hair, because there are cultures out there that believe that you will bring harm to either your baby or yourself. Okay? There are cultures out there, now here in the United States, the first year birthday is a big deal. But there's some cultures out there that they celebrate the 30-day birth because the baby made it through 30 days. Okay, so that first year birth is just an extra cake. Because the real celebration is 30 days. Yes.
When we're measuring, is the gestational sac and the yolk sac as well, right?
Because you're gonna see the gestational sac first. If you don't see a yolk sac, don't worry about it,
Okay,
because it's too early.
okay. But when we're measuring that, we're not putting that into a package, right? Cause there's,
Yes, we're putting that into a package.
we are putting that.
Yeah. Mhm.
On the
All
same-
of our measurements we put in a package.
And that's on the same image when you're measuring the long and transverse surface?
Yes,
Okay.
yeah. You can still put it in the package and the images be just one image.
Okay.
Yes,
Yeah, when the fetus is already formed, you can see the baby's face and heartbeat and everything.
The baby's-
Why we still measuring the yolk sac?
well, the yolk sac eventually is gonna disappear. The yolk sac is the very first thing that we see.
Yeah, but already, like yesterday, we have the case where lady that, I think it was 14 weeks. You can see the baby's feature and everything, the heartbeat, but he was measuring also the yolk sac.
Correct. We measure it until it disappears.
Oh, okay.
Because once it disappears, if it doesn't disappear, that's an abnormality.
Yeah, because the baby
Usually
was
it's
totally there.
Mhm.
It has the leg, the hands, and
Mhm.
everything movement.
Yeah.
But still, there was a yolk sac in there also.
You always measure. If it's there, you measure it. Because part of that is gonna be incorporated into the baby. If it still persists, that's an abnormality. Okay, yes,
When it should be disappear?
we'll get to that. Okay, we'll get to that. Okay, so we're gonna measure the BPD, the OFD, the head circumference, the abdominal circumference, and the femur length. Okay, so let's talk about that just a little bit. Can you hit the lights? Okay. Can y'all see that? Let me try the green.